Hey guys, my name's Sam and welcome to Prep Medic. In today's video, I'm going to be giving you an overview of a brand new product from North American Rescue called the Spear. So most of you are probably familiar with the ARS needle by North American Rescue. I went over this in my needle decompression video. But North American Rescue actually just released a brand new device called the Spear, which is quite a lot bigger than the ARS and brings with it a little bit more functionality, in my opinion. So I'm not going to go over exactly what a pneumothorax is. You can go to my tension pneumothorax video and my needle decompression video to watch more about the indications, contraindications of needle decompression and exactly how to do it. But I am going to go through the process of inserting the Spear, and I'm going to give you an overview of this device and some of the functionality it has over the ARS needle. So right away you're going to notice that the Spear looks very similar to the ARS needle. They're both similarly packaged and you take them out the same way. So we'll just remove the cap here and you're going to notice that there's a tower of stuff where on the ARS needle there wasn't. So as we bring this out, I'll kind of explain to you what's on this device. The Spear stands for Simplified Pneumothorax Emergency Air Release. I really think that was kind of their excuse to get something that ended up spelling Spear because, you know, obviously this thing looks like a spear. And right away you're going to notice that this needle is quite a lot bigger than the traditional ARS. This is a 10 gauge needle where the old ARS was 14. They did come out with a 10 gauge later because TCCC was telling us that that was better. Obviously, the larger the diameter of the catheter, the more air can escape, and that's not going to occlude over time as easily as the 14 gauges were. But in addition to width of the needle, this needle is actually a little bit longer. So this is 3.75 inches as opposed to 3.25 inches long. Obviously, this has a couple more parts on it than the ARS needle, which just had the needle and the catheter that slid over it. So on the tip here, we've got a modified bezel. They say it's sharper than a normal needle, so it can puncture through larger amounts of tissue, especially when you have a larger diameter needle. It's going to be harder to insert. So they've made that extra sharp. Although it's not technically advertised, one of the reps was telling me that you can actually take this and you can use this to make a small incision if you're having trouble getting through the initial layer of skin. Next thing you have is you have the catheter. This is the flexible plastic part. That's going to go into the patient. This bends and they say it won't kink very well. It's got a soft tip here, so it's going to reduce the amount of lung tissue damage. They say, I don't know how much of a difference that'll actually make, and I haven't seen a lot of studies on this, so I'll get back to you with those probably in a later video when more have come out. It has what they call fenestrations going down, so you're going to notice on this catheter here there's little holes, and those are just going to help continue to facilitate the air release from the chest, so it's a little bit less likely it's going to become occluded from all of those holes. Obviously the end is the 14 gauge portion, and that's going to be the most effective. So coming up the needle, you have a lure lock or a twist lock here, and what that does is if you're gripping it down here to do the decompression, as you're exerting force downward, it makes it so that the catheter can't slide over the needle. It can't come there and make it so it's harder to stab into the chest. So they lock it back, and that's just to keep it in place. Beyond that, you have the hub of the needle here, and then on this end you have a device. It's a one-way valve, which they flat out admit in their literature that it's not needed, but a lot of people really wanted one. It will keep some contaminants out of the needle, and the other nice thing that this will do is instead of listening for a whoosh of air, when you do the decompression, it will actually make a small noise, so it'll be a little bit easier to hear the air evacuating the chest. I'm honestly not sure how well that will work, but it is an interesting idea if it does. Okay, so the next thing I want to do is I want to go over to our mannequin, and I'll actually show you the procedure for inserting this because it is quite a lot different than the traditional ARS needle. All right, so right next to each other, you can kind of see the comparison here. You can see how much larger the Spear is compared to the ARS and how much more complicated this is. Which the complication, I think, serves a purpose, so it's not bad, but you know, will make it just that much more difficult to perform the skill under stress, so keep that in mind. Okay, so you have two main sites for your Spear insertion. The first one is going to be your second intercostal space right above the third rib at the midclavicular line. And the second site is going to be your 5th intercostal space at the anterior axillary line, right above the 6th rib. The first step in inserting the spear is to sterilize your site, and I can't use this site on this dummy because there's hard plastic there, so I'm going to be using the anterior site. So the first step is to identify your site with your landmarks and sterilize it. We're going to use an alcohol pad, and I'll just simulate that I have one. And you're going to sterilize that site as best you can, and then you're going to do your finger too, and I'll show you kind of why that is as we start the insertion. So you're going to find your site, and you're going to find your 3rd rib in this case. On this site, you'd find your 6th rib, so it would be the rib right below the space you're going to use. So I found the 3rd rib, and I'm going to take this and I'm going to stick it right onto the rib. I don't want to stick it into the space yet. So I stick it onto the rib, and I'm going to stick it until it stops on that rib. And you're going to notice there are black lines up here. Those are centimeter marks, and that's going to measure how much adipose tissue is present on this patient. And that's where you go from your depth insertion, from this mark here once you hit the rib. So between that rib and your pleural space is pretty much universally 3 centimeters in patients, no matter how much muscle or adipose tissue they have. So this allows the spear to be inserted at a much more accurate depth, which minimizes tissue damage of the lung, is what they say at least. So now that I've inserted to that line there and it's resting on the rib, I'm going to take my other finger and I'm going to measure up 3 centimeters with that pointer finger. So now that I have that measured, I'm going to push it straight down into the pleural space until it gets to my finger. Once I get there, I'm going to take this and I'm going to rotate it, and I'm going to actually point the needle to the middle of the clavicle, so the midclavicular area. I'm going to release the catheter from the rest of the needle, and I'm not going to pull the needle, I'm going to push the catheter into the patient, just like that. I am then going to remove the needle, and I'm going to dispose of this in a safe space. I'm going to take the one-way valve, and I'm going to apply it to the end of this. And now I'm going to tape this down so it doesn't come out. And you can do that based on your policy. They don't have like a specific holder for it or anything like that. Like I said before, the one-way valve, and North American Rescue has even admitted this, that the one-way valve is not necessary. The one nice thing it does offer in this case is it protects any dirt or contaminants from getting into that tube, and it also will give you a slight sound notification if air is venting from that chest at any time. And once again, I don't really know how well that works, but it is an interesting idea, and I'm excited to try it out. Your insertion in the lateral site is going to be almost identical. You're not going to really change anything, but when you do rotate it, you're not aiming for the clavicle, you're just going straight up and then pushing the catheter in just like that. I think this is a pretty neat device. I'm interested to see how this functions in the field, if it offers better outcomes than the standard ARS. Just with needle and catheter diameter alone, I think it offers a pretty large advantage. And then I am also excited to see how this one-way valve works, if that notification sound actually will function in the back of a noisy ambulance. If you have any questions, leave them in the comments down below. I always enjoy hearing from you guys. Next week, I'm going to be putting out a video of my off-duty EDC, and I've got some new pieces of gear I'm excited to share with you guys. So stay tuned for that, and I will see you next week.